Allergy and Infectious Diseases since 1984, has worked with numerous presidents, has researched to prevent, diagnose, and treat infectious diseases such as HIV, AIDS, respiratory infections, and a multitude of problems. He has been someone that I think members of Congress have consistently looked to for straight information, for adequate medical professional information. I know that we have relied on him in the Help Committee. I have relied on him, and you know that I have quoted him often. So it's a real honor to have him with us today for a few minutes. Dr. Fauci, I'm going to turn it over to you for some opening remarks, and then I got some media folks here that are just itching to ask you a few questions. So thank you so much, sir, for joining us.
Thank you, Senator, for having me. I really appreciate you giving me the opportunity to be with you today. I'll make my remarks very brief because I heard the very nice and complete introduction that you have just given about some of the issues that you're facing where you are, as well as the rest of the country. So the issue is that we're facing a serious problem now, because as was shown in one of the graphs that the senator mentioned, when you look at what's happened in other parts of the world, where there was a peak of infection and then a return back down to baseline. Unfortunately for us in the United States, being a large country, a heterogeneous country with different levels of outbreak throughout different regions, states, cities, counties, we have peaked at a high level and stayed at about 20,000 cases per day for months until just recently, about a couple of weeks ago, when we tried to start opening in certain of the states. And as the senator said very appropriately, sometimes a bit too soon, sometimes jumping over some of the checkpoints, we now have a resurgence where we've gone up as high as 57,000 cases, which is almost double what it was at our so-called high baseline. So we have a situation right now that we've got to proceed to continue to try and open, but in a safe, measured, very prudent manner. And I'm sure there are going to be a lot of questions about that, because I don't think it should be all or none, either shut down completely or throw caution to the wind. If we're going to open up safely for the economy and for employment, we need to do it in a way that's well thought out and cautious, but nonetheless continue to proceed. So, Senator, rather than just keep talking, let me stop there, because I know there are a lot of good questions that the press would like to ask.
Thank you, Dr. Fauci. If you don't mind, I'm going to take the liberty, the senatorial privilege of asking the first one, because last week in our hearing in front of the Help Committee, you had an interesting dialogue with Senator Paul. And Senator Paul's point was, we got schools that are coming up and opening. And he has quoted some statistics that indicated that children are not as likely to transmit the virus as others. And I know that in Alabama, a concern about schools and school safety, and not only the children, but also their teachers and their families, are of paramount importance. We're looking at schools opening up starting in early August and certainly by mid-August. Can you talk a little bit about the guidelines and what folks should expect as we get schools open, and what precautions that you would urge the school systems to take?
Yes, Senator, thank you for that question. It's really a critical question. We get asked all the time. First of all, I think it's important as a fundamental principle within the reasonable guidelines of safety and concern for the health of the children and their families. Nonetheless, we should try as best as possible to get the children back to school and the schools open, for the simple reason that the secondary unintended consequences of having children not being able to go to school has ripple effects for the family that might have deleterious effects that really override the so-called safety benefits. So you don't want to be risking the health of the children or their families, but you've got to follow the guidelines depending upon the level and the penetrance of infection in the community. There will be some counties where the infection is so low, you won't have to worry. You could open the schools with very little additional type precautions other than the usual public health. In the other situation, you might have counties or parts of the state in which there is enough viral activity that you might want to modify scheduling. Things like masks at all time, things like alternating morning, afternoon, decreasing the size and the space between desks. These are things that school principals and superintendents are thinking about in a creative way. The bottom line, Senator, is that it's not going to be a one size fits all. It's going to be what the level of penetrance is of the infection in any given community.
All right, thank you for that. And I want to just emphasize to folks as well that it is also that parents and families are going to also have to rely on these school systems and work with these school systems. Let them, if they impose things that you're not particularly crazy about, you need to go ahead and work with these school systems to keep these kids and yourself healthy. I think that is a very, very important for all our parents out there, grandparents, whoever has children that are going to go to these schools, to understand whatever is being imposed for the safety and well-being of the children, the faculty, and the community. So please, please participate with whatever conditions that are the school systems in their best judgment believe should be imposed. So thank you. And with that, Bo, let's ask our first question from the media.
Eddie Burkhalter, Alabama political reporter. The percent of tests that are positive remain high in Alabama, and we continue to see record highs in hospitalizations and new cases. Yet Governor Kay Ivey hasn't instituted any new restrictions. In your opinion, what would you like to see the governors and states with increasing coronavirus cases do?
Well, that's a good question, and we have some pretty standard answers for that. When you look at what we can do that we know works, it's the use of masks and physical distance and avoiding crowds. And I think to the extent in which this would be acceptable in the community, I am strongly in favor of mandating things. I don't like to be, authoritarian from the federal government, but at the local level, if governors and others essentially mandate the use of masks when you have an outbreak, I think that would be very important. Also, bars. We know that bars, particularly bars that are indoor, some bars are outdoor, but most of them are indoor. When you are indoor in a bar, in the crowded situation in a bar, that's a perfect setup for the spread of infection. So simple things, fundamental things like masking, distancing, washing hands, closing bars. If you do that, I think it'll be a giant step towards interfering with the spread in your community.
Let me follow up on something, Dr. Fauci, that I just saw recently in the last couple of days that I'd like for you to maybe comment on. There is some discussion from the WHO, the World Health Organization, that the virus, these particles, may linger in the air a little bit longer than first thought. I don't think that science is completely up to date on that right now. But have you seen that, and could you comment a little bit about that?
Yes. It's referred to as aerosolized, or sometimes referred to as airborne, which means as opposed to a respiratory droplet, if I cough or sneeze or even speak, you can get thin droplets that go out for a certain number of feet, usually 3 or 4 feet, and then they go to the ground. And that's the reason why we talk about the 6-foot distance. When you talk about aerosol or airborne, there have been demonstrations of viruses that can actually stay in the air for much longer and hence get caught up in the circulation system of a given room. There isn't a lot of definitive evidence about what the impact of the aerosolization is on COVID expression. However, we have some good examples back with SARS, which is a similar virus, where there were clear-cut examples of spread by aerosol. So although we don't think it's a major issue of spread, it's something that we can't completely rule out, which is a reason, Senator, why we insist that people wear masks, because that will protect you against that.
Okay, Bo.
The next question comes from Ed Howell, Daily Mountain Eagle. What is the best type of mask that the general public can get? The blue disposable surgical mask, the washable cloth mask you see advertised online, or the homemade ones?
Well, actually, any covering for sure is better than no covering. The best, the best one is the one you don't want to use because it really should be saved for the healthcare workers, and that's the N95. But the surgical masks that we have, the plain old cotton ones, the paper ones, they work fine. The cloth masks we found also work in many respects as good as that. If you can home make a cloth mask that really is the same as you see with the ones that are made by companies, they're fine. I wear a cloth mask. Some of you may have seen at the hearing that I was at, I wore a cloth mask that said my favorite team, the Washington National Baseball Team, but that was a cloth mask. So you're okay with that.
Okay.
Brian Lyman, Montgomery Advertiser. Individual city and county governments in Alabama have adopted mask ordinances, but Alabama's government through Monday evening had avoided a statewide order. Can individual governments' mask orders be effective in the absence of a statewide mandate, and why or why not?
Yeah, no, they could be. I mean, I think, as I mentioned just a moment ago, individual mandates, wherever they come from, I think are important because when people get a signal that you may or may not want to wear a mask, which means it may or may not be helpful, that's a very confusing signal. This I have here is a cloth mask that clearly would protect me. So if you say it doesn't matter whether you put it on or take it off, you're giving a wrong mixed signal. The signal should be wear a mask, period.
I want to just follow up on that too. And it's something that the members of the media have heard me say over and over. And that is an appeal to our state leaders, our local leaders, our business leaders, our community leaders. Set the example. You be the examples, because when people see you with a mask out in public, they will follow that. They will look and see. And so please, please listen to what Dr. Fauci has said. Help us set the example, regardless of whether there is a mask ordinance in your locality. You still are a leader in that community, and you should be setting the examples. Bo?
Glenn Wilson, New American Journal, asks, what is the latest thinking on how COVID-19 is most commonly being spread?
Yeah. Good question, simple question, important question. It's certainly not commonly. It is spread by the respiratory route. When people are close to each other, and I think what we need to emphasize today is something that we have to say over and over again. You should not think that the only way that you can get the infection is if someone coughs on you or sneezes on you. That's not necessarily the case. That certainly is one way in which it is transmitted. But another way is about 20 to 40% of the people who are infected have no symptoms at all. So you may be standing next to someone, and this is the reason, as the senator just said about masks, you could be standing next to someone who looks and feels perfectly well, who is infected, who is not coughing and not sneezing, but merely speaking to you. Because we now know from experiments using laser lights and various refractions, where when people merely speak, you can see very small micro droplets go out. So if you're within 6 feet of someone who is infected, even though they're without symptoms, there is a possibility that that person can transmit it to you or you to another person.
Dr. Fauci, let me follow up with something that I think is important for folks to recognize as well, and that is some of the statistics that I was reading and seeing this morning was that the median age for folks that are testing positive has dropped by about 15 years in the last month or so, and we're seeing more and more younger folks, at least younger compared to me and you, they're a lot younger. And that is something that I think folks early on were taking for granted, that this was a virus that was a senior citizen's virus, that if a young person gets it, they're not going to have any real problems or symptoms. But could you comment on how this affects young folks and what we're seeing today, and also maybe on the unknown, that this virus is still young and we just don't know the long-term effects that it might have on even a healthy 30-year-old?
You're right on the money on that, Senator, and that's a very important issue. You are absolutely correct. The mean age of people getting infected today, particularly in the states that we mentioned, is a decade and a half younger. You're absolutely correct than what we saw months ago. The issue of young people getting infected has two aspects of it that we need to emphasize. A, it is true that in general, on the average, young people do not have as serious consequences of getting infected as elderly people and people with underlying conditions, regardless of what your age is. Because if you're a young person with an underlying condition, diabetes, obesity, heart disease, hypertension, you're as risky as someone who is the elderly. Having said that, even though the incidence is less of serious complications, we are now getting multiple examples of young people who are getting sick, getting hospitalized, and some of them even requiring intensive care. The death rate is lower, I admit that, because people in general who are young are healthier. But that doesn't mean that you could not get seriously ill. Point number two, which is also important, even if you do not get any symptoms and you do perfectly well, by getting infected, by allowing yourself to get infected because of risky behavior, you are part of the propagation of the outbreak. So you are part of the problem, because you could, even though you feel fine, you could inadvertently and innocently infect someone else, who then inadvertently and innocently affects someone who's really vulnerable. An elderly person, a woman who's getting chemotherapy for breast cancer, a young child with leukemia, any of those people, even though you didn't know it when you got infected, even though you're perfectly innocent, that you meant no harm, by getting infected, you're propagating this pandemic. So look at it at two ways. One, danger for yourself, and the responsibility to society.
Thank you. Bo?
Brad Gunther, NBC 15 in Mobile. While the number of cases is rising, the mortality rate is on the decline. Is this a function of better treatment options, the primary age group shifting to a younger, healthier population segment, and/or a mutating virus?
The top two, but not necessarily the third one. So yes, the age group, as the governor and I, as the senator and I just mentioned, is about 15 years younger. So the younger you are, the better you do, and the less likely you're going to get seriously ill and die. Number two, we definitely are better now at treating individuals, particularly because we have a couple of therapies that work well in people with advanced disease. The idea that the virus is mutating and so less damaging to people has not yet been proven at all. So I don't think you can rely on the third one. But the first two options that you mentioned are entirely correct.
And let me follow up with something very quickly that I want to emphasize, and you guys have heard me emphasize this before, especially to folks in the media. I think we do a disservice sometimes by focusing on the total amount of deaths, because we've seen a rise, and that's a problem for sure. But as the percentage of deaths may come down, that does not mean that this virus is not still very, very serious. That disrupts education, disrupts businesses, disrupts lives, because it still is. It still will be deadly. But I don't want to get into a situation where we just come to accept a lower number of deaths as if this is the new normal. We've still got to do everything we can to get this virus snuffed out. We've still got a ways to go on vaccines, and I'm sure Dr. Fauci may answer a question about that in a moment. But we've got a ways to go to get this economy back up, and we got to do it safely. So just because deaths as a percentage of total cases may be coming down, it's no reason at all to kind of let our foot off the gas when it comes to our social distancing, wearing masks, and trying to control this virus. Bo?
Kim Chandler of the Associated Press asked, how soon after exposure will a test determine if someone has gotten infected?
Yeah, the test will probably be a positive in a couple of days. The incubation period to getting symptoms is about 4.5 to 5 days. The test, which is positive before you even get symptoms often, is called pre-symptomatic capability of transmission, is probably a couple of days. I want to emphasize, just because it's such important, what the senator just said, that it's a false narrative to take comfort in a lower rate of death. There's so many other things that are very dangerous and bad about this virus. Don't get yourself into false complacency. But answer to your question is a couple of days before it's positive.
Let me, speaking of tests, Dr. Fauci, I know that this is not particularly your area, but you work so closely with Dr. Redfield and Dr. Hahn with regard to test. And there are reports now that testing is still a little bit of an issue around the states. I know we're doing our best to get more tests out there, to get more rapid tests. I had some communications with a couple of our hospitals around this week who are still struggling to get as many tests as they really need. Can you give us an update on where you think the testing capabilities in the country are and where you see them heading as we go into the school year?
Yes, Senator, we certainly are doing much, much better than we were during the problematic early months of this pandemic. But even though the numbers look good, and this is the thing that is a little bit concerning, you say, well, we now have 37 million tests have been performed. The question is, when you get on the phone and talk to the people in the community, there are still lapses there where the dots are not being connected. So even though we've come a very long way and we're doing much, much better and we'll continue to do better, we still are not at the level that we would like to be.
Dennis Pillion, AL.com, asked, how does the COVID surge in Alabama compare to other states?
Well, if you look at the curve that I just had in front of me, it's still going up in the sense of being rather steep. The baseline that you were at was much lower than many of the other states. But what's alarming is the slope of the curve. When you see a slope that goes up like that, you've got to be careful that you don't get into what's called an exponential phase, where every day it can even double or more. You're not there yet, so you have an opportunity, a window to get your arms around this and to prevent it from getting worse. It's not to the point where it's out of hand and very, very difficult to control. So you have a window of opportunity here that, as a state, you should take advantage of that window of opportunity.
Morgan Hightower, WBRC, Fox 6, Birmingham. Considering how contagious and potentially deadly COVID-19 is, when a vaccine becomes available, are you going to suggest it's mandated for Americans to get?
I don't think we've ever had a situation where you mandate it for the general population. So let me give you some example of mandating. So I'm a physician. I see patients in my hospital right literally out the window here across the hall at the NIH Clinical Center. During the flu season, the administration of the hospital mandates that I have to get a flu vaccine. Otherwise, I won't be able to see patients the way I usually do. That has not happened ever, to my knowledge, at a national level or even at a state level. So I could see individual institutions mandating a vaccine. I don't see it on a national level, merely because of all the situations you have upon encroaching upon persons' freedom to make their own choice of their own health.
Mary Scott Hodgins, WBHM, Birmingham. What are your thoughts on the politicalization of health information and wearing masks? What's the impact of this?
Well, I think any politicization of anything that's a public health matter has negative consequences. And that's the reason why we try as best as we can to not let political issues get involved. I mean, obviously today, it's no secret to anybody who lives in the United States that we have a great deal of polarization in our country. Unfortunately, we hope that changes. But there's no place for that when you're making public health recommendations, analysis of data, or any policies that are made. That will always be to our detriment to do that.
Lauren Walsh, ABC 3340 Birmingham. With mask orders in effect across our area, some people are wearing their mask but only covering their mouth and not their nose. What are the dangers of only covering your mouth?
Well, you've taken away 50% of your protection. So because the mask is for both inhaling through the nose and the mouth. If you cover your mouth and not your nose, you're leaving open a vulnerable part. And that's the reason why, if you have the opportunity, they even recommend in situations in which you have a lot of activity that you even wear eye guards, or goggles to prevent it. But to wear a mask like this, I mean, it just, half of it's out. So you shouldn't do that.
Lisa Crane, WVTM Birmingham. What data do you have that illustrates states with more stringent orders to stay at home and keep businesses closed are seeing lower infection rates than those states that aren't as stringent?
Well, the data are overwhelming, not only with individual states, but individual countries. And you see what happens when you see the curve go up. You do stay-at-home orders, it comes right back down. The curve that the senator showed in the beginning of the discussion before I got here, but I was listening in on what he was saying, was that when you look at what happened in Europe, it went way up and they shut down. About 95% of the country shut down. The United States, even though a lot shut down, it was only about 50% of complete shutdown. So our curve went up, started to come down, then it plateaued at around 20,000. That tells you that if you shut down and you stay at home, you will bring it down. If you do not do that, you will either not bring it down at all or you won't bring it down completely, which is actually what happened in the United States.
And for the media, I would say if anyone hasn't seen that graphic before and you need it, please contact our communications office and we will get that to you that you can use.
Jennifer Horton, WSFA Montgomery. Could you both discuss your perspective on the current funding model for drug development, specifically public funds that are used to develop medications that are sold commercially? Is this a functional model for the government and taxpayers?
Well, the federal government, particularly our Congress, of which your senator is certainly an important member, have been extraordinarily generous in the funding of the National Institutes of Health and the CDC and other agency involved in the response to this pandemic. And much of that has gone into the development of vaccines and therapeutics. So I think you can rest assured, I'm sure you can rest assured that the government, led by the Congress with the administration signing off on it, has been very generous to us in the development of therapeutics as well as vaccines. And quite frankly, we already have now 2 therapeutics, remdesivir and dexamethasone, which have shown to be quite effective in people with advanced disease. What we need more of are drugs, and we're doing clinical trials with this, monoclonal antibodies, passive transfer serum, given to people who are early in the course of their disease.
Great. I know Dr. Fauci has a hard stop in a moment. Bo, let's get maybe one more question, and then we'll wrap this up for Dr. Fauci's benefit.
Okay. This one is actually, hold on. Let's go with Eddie Burkhalter, Alabama political reporter. Many people in Alabama, as in many states, aren't wearing masks while in public, yet we know many people infected are asymptomatic. Can you speak to the importance of wearing masks, and do you think a statewide mask order is a good way to encourage practice?
Okay, I do believe a statewide mask order is important because there is a variability in people taking seriously or even understanding the benefit of masks. In direct answer to the first part of your question, masks make a difference. It is one of the primary fundamental tools that we have, particularly as you mentioned in the question, because a considerable number of individuals, up to 40%, do not have any symptoms, and yet they still can transmit the infection. And for that reason, we should all be wearing masks when we're out in public, particularly when we can't negotiate the distance between ourselves and others in public.
So with that, folks, Dr. Fauci, thank you so much for being here with us today and giving us the benefit of your expertise and your time. I know the demands on your time right now are absolutely extraordinary. I don't see how you do it sometimes, but you are always there, always available. And I also want to thank you for all that you have provided to Congress, because I was reviewing my notes recently from some of the early conversations that we had in January about this virus. And you and Dr. Redfield and others were there, provide us the early warning signs about what was going on. So thank you so much again for being with us today. We really appreciate it. Keep doing what you're doing. We need you, and we need your voices out there. And to all the media, thank you. Thank you, Dr. Fauci. And to all the media, thank you for joining us today. We really appreciate it. I want to end with this note. And remember this, Alabama now has over 1,000 deaths, but more importantly, in the last 7 days, our 7-day average has quadrupled just in the last few days. Quadrupled, folks. We got to be careful. Social distance, wear your mask, be safe. Thank you all.